morning, everybody. My name is Dan Ohime. I am the National Program Coordinator for Dagomo Foundation, Nigeria. Dagomo Foundation is an elder care-based NGO with offices in Benin City, Edo State, Abuja, and Lagos. Today, we're going to be having a very interesting webinar. We said we'll start by 10, and then we gave a little time. First, I want to welcome everybody to this webinar. We're going to be considering a very interesting topic on the impact of policy on older citizens in Nigeria. I think that's something that's very rife at this very point in time, and I have no doubt that the people who we have invited to, discuss this matter will do extreme justice to it. So I'd like us to be very attentive. There will be times for us to ask questions. Have your questions or comments are taken. So there'll be times where you'll be asked to vote in terms of what your opinion is for the questions. They will pop up on the screen, and then you just click on what you consider to be the best answer at that point. It's just to help us get some data around what we are doing and also to shape our action plan going forward. Once again, good morning. And now I'm going to introduce our CPO. CPO stands for Chief Program Officer, what you may refer to as a Chief Executive Officer in other setting. She's going to give us the welcome address. She's from our Lagos office. She's no other person than Engineer Mrs. Titi Park. So I welcome Engineer Mrs. Park to welcome you to this webinar. Thank you. Mrs. Park, please.
Thank you kindly, Dan. Good morning, everyone. Good afternoon, depending on wherever you're joining us from, or good evening. We're really honored that you've chosen to spend this time with us today. And I'm actually looking forward to also learning on the subject matter. Just earlier on in the week, I was reviewing some material from somebody known as Dr. Isabella Aboderi, and she was talking about the level of policy development across Africa, across sub-Saharan Africa, and how some African countries have keyed into the regional policy, they have their national policy, and they have the institutional framework to support that. And it'll be very interesting to see where exactly, or the advancement in Nigeria in the area of policy on elder care. So I'm excited myself, and I thank you all, especially our resource persons, and I invite all of you to relax and learn and participate. Thank you so much. So over to you, Dan.
All right, thank you, Mrs. Okay, thank you very much, Mrs. Park, for that warm welcome. All right, so if you're just joining, this is Dagomo Foundation webinar. Thanks for joining. We're going to be looking at the topic on elder care policy as it affects the, older citizens in Nigeria. So we're going to go straight to the first facilitator, or the first talk or lecture, whichever you want to call it. I just want to briefly give a background around the speaker. Her name is Dr. Mrs. Ogugwa Osi-Ogu. She's the head of Geriatrics Medicine Unit, Medical Medicine Unit in the National Hospital, Abuja. She's also a consultant physician in geriatrics at the National Hospital Abuja, like I just said. She specializes on providing diagnosis, treatment, and prevention of disease and disability to elderly people. She has been very much in the front lines in terms of the advocacy. She's a very passionate elder care person and a doctor. She's represented this front in Nigeria and other parts of the world. So ladies and gentlemen, I'm very delighted and happy to now give the floor to Dr. Mrs. Ogugwa Osilbu, who will be talking on the topic for the next 20 minutes.
Thank you, Barrister Dan. And it's really exciting that we're talking about older adults today. I want to thank you and your team at Dagomo Foundation for this opportunity. I'm trying to share my, there we go. Share my screen here. Right, so I'm excited that we're doing this, and thank you for having me to talk about this topic. So looking at policy impact on older adult care in Nigeria. I'm going to go through this outline, do a bit of introduction on aging, look at the realities of aging in Nigeria, the challenges of older adult care in the country. I'll look at the global strategy and action plan on aging of the WHO, available policies for older adult care in Nigeria, and then conclude with a summary. So it had been estimated that we would have about 11 million people over the age of 60 in Nigeria by 2020. But the National Bureau of Statistics actually did a survey on living standards this year, and that number for 60 and above is a whopping 15 million, 4 million more than had been estimated for Nigeria. So we use the cutoff of 60 and above to describe an older adult. I know I have colleagues who are almost 70 who say they are not yet eligible to be my patient. We all want to get old, but again, we don't want to be described as older. So aging is a process. It starts from the uterus, from when the baby's been formed, from conception. We used to think it started from birth, but we now have adequate information to know that the process starts from conception. So a baby that is carried in the womb of a mother who's alcoholic, indulged in tobacco, did not have good healthcare seeking behavior, that child would not grow up, would not age as well as one that grew up in the uterus of a mother who didn't have any of those issues. Older adult care requires a multi-sectoral, multi-stakeholder approach because there are multiple determinants of aging. So the process starting from conception throughout the life course, and different things affecting it. I'm going to show you a slide that lists or depicts all of those different determinants. So those different determinants then give us a platform for intervention when we want to think about people remaining healthy and keeping engaged as they age. For us to harness the dividends of the demographic change, people must remain healthy as they age. And really that's the focus of a lot of the international and regional instruments, that governments are accountable to making sure that their citizens remain healthy as they age. So it's a life course approach. As a child is born, does that child have access to all the immunizations? Is that child prevented from having infections like diarrhea, pneumonia that we know contribute to childhood mortalities? As we go to the next age brand, is this child in school receiving adequate nutrition? Do they have enough platform for physical activity? All of the things that contribute to healthy aging. So it's a total life course approach that people live. As they live longer, they are actually healthy and they can continue to contribute to the fight. So these are all those determinants of healthy aging, social and services, environment. So studies have shown that those who live in deprived environments, no good water source, sanitation is poor, poor housing, all of that contributes to not aging as well, not being healthy as they age. the health behavior of the individuals, mental makeup, the burden of disease. So those who have multi-morbidity, which increase the risk of diseases like diabetes, hypertension, strokes, cancer, all of them increase the risk for remaining unhealthy or being disabled as you age. So all of this, urbanization, transportation, cultural patterns, development, all of this, poverty, to how people age. I mean, how people are, how healthy people are as they age. There's a myth that every older adult is the same, but it's a very heterogeneous group. You have those who are very functional and could have functional capacity of a 30-year-old, so they can do everything for themselves. We've seen 78-year-olds who are running marathons. So you can, of course, we have them as presidents of nations. So we cannot say that there is any phenotypical description for older adults. At the end of the spectrum, you have those who are quite dependent. They need assistance for all of their daily activities, those activities that we all take for granted. You can get yourself out of bed in the morning, go to the toilet, take a shower, dress up yourself, feed yourself, cook, drive, do your banking. There are people who require assistance for all of this. And that's not the way we want people to age. So as people get older, we want them to be as independent living as possible so that they can function independently and not require and not be that dependent on others. But for that to happen, health is really the key critical element. Let's look at the settings where older adults will require care. There are those that would require care at the acute care settings, so hospital-based. You have a stroke, you have severe pneumonia, would admit you into an acute care hospital. At the community level, where they should go for promoting health services, primary health care centers will be where they'll be care for that. There are those who are homebound and require care in the home. There are those who require care in long-term care facilities. At all of these settings, we must have adequate capacity in terms of personnel and infrastructure. So all of this should be aligned to the needs of older adults so that they actually get adequate care at those settings. What are the realities of aging in Nigeria? Older adults actually are faced with a lot of challenges. In the healthcare sector, there's a capacity gap for their care. We do not have, sorry about that. We do not have adequate personnel or infrastructure. So for our 50 million older adults in Nigeria, we have less than a dozen geriatricians in the country. So that gives us a ratio of almost 1.3 million to 1 geriatrician. That is a huge capacity gap. We do not have the adequate infrastructure. Remember, I said they need care at different settings. So long-term care facilities are non-existent. Palliative care facilities are very rare. Currently, it's actually older adults in Ibadan, in the Southwest, probably a better place than anywhere else in the country. We have the Tony Anini Geriatric Center, which is a one-stop center, meaning it has all of the different clinics, specialty clinics that older adults will need, eye clinic, dental clinic. It has theaters within that center, so if they need surgery, they can have it right there. The different specialists come to see them there, orthopedic surgeons, the neurologists, the psychiatrists see them under that one roof. So it's a one-stop shop, and they also run daycare facilities for older adults to just come from their homes and interact with their peers. Also in Ibadan, there is a rehab center that is specific for older adults, which was donated by by a philanthropist, Kasintin Adebutu. So Ibadan right now also has a palliative care unit, which is being run by Professor Shinyowu. So Ibadan really is where to grow old in Nigeria at this time. So outside of those facilities, we have geriatric units in other tertiary institutions, UPTH, University of Port Harcourt Teaching Hospital, University of Benin Teaching Hospital, and my hospital at the National here in Abuja. We have huge space constraints. My hospital started as a hospital for women and children, was expanded to provide care to other people in the community without expanding infrastructure. So currently we do not have a specific geriatric ward. We have older adults being admitted across the different wards in the hospital. So there's a huge gap there. In terms of personnel, older adult care or geriatric care requires multiple disciplines. You have the doctor, you have nurses, physical therapists, pharmacists, social workers, all of these people with skills and knowledge in taking care of older adults. And currently, there is no training curriculum in the country that includes, for any of these health workers, that includes geriatrics. So that, again, is part of that dearth of capacity for healthcare. There's a lack of health insurance coverage. We know that as those who are in the formal sector, once they retire, their health insurance coverage ceases. And these are the people who have the burden of multi-morbidity and they spend a lot out of pocket. Once you spend more than 15% of your income on healthcare, that is described as catastrophic out-of-pocket spending. And a lot of our retirees end up doing that. Their income is already dwindled, and then they're spending a lot on healthcare. So that's also an area of intervention to be able to improve healthcare of older adults. There's poor access to assistive devices. So we know that with increasing age, there's a risk not just for disease burden, but also disability. There are stroke survivors who are not able to walk on their own, so they need walking frames or a cane or even a wheelchair. There are those who have visual issues and they require eyeglasses to be able to see or read. There are those who have hearing impairments and they need to have hearing aids. So all of these assistive devices currently older adults are having to pay out of pocket for when they can source them. Hearing aids are actually a big issue locally. A lot of it costs a lot. So if you don't have children who can afford to buy your hearing aids, a lot of those people go on without being able to engage with the community because of the poor hearing. The social issues are also quite numerous. We all know about the irregular pension payment. Only about 7.5% of older adults are eligible or eligible for pension payment, but even that percentage, the payment is very erratic. We've seen cases where these older adults are on the streets protesting because of lack of pension payment. If they're able to get their pension, it would really take them a little more than the stage where most of them are right now. Older mothers who are grandmothers in communities, if they had some money to spend, it would actually regenerate wealth in those communities. Again, another avenue for intervention in providing better care for our older adults. And for those in the informal sector, there really should be a social security payment. Right now, Ekiti State and Osun State are sort of taking the lead in that regard. Osun has a project called Agba Osun, where those that are very vulnerable and indigent are given 10,000 naira a month. And for Ekiti, when you're 65 and above, you get also a stipend of 5,000 a month. this really goes some ways. The monies are not a lot, but it's better than not having anything at all. There is poverty, especially in the rural areas. We know about the rural urban migration of our younger ones looking for better economic situation for themselves, leaving these older adults alone back in the rural settings without much to live on, especially in the instance of not having any social security payments from government. A lot of these older adults are still working hard to be able to have their daily earnings. I had cause to interact with a group of older adults here in the rural setting around Abuja. These are 70 plus. They're still tilling the ground because if they didn't go to the farm, they didn't have food to eat. When you ask them about children, and one of the women laughed at it because she said her children also have their issues. They don't have so much money to cater to the needs of their own immediate family. So the family dynamics has changed significantly. We've always had pride in the fact that in Africa we take care of our own, but the economic situation in the country is bringing difficulty or challenges on this practice. There's a high dependency level. Older adults are living either with their children or if where they live in their own homes, those children live with them, but they need care from those children. Their family members are providing economic support solely, and so they lose autonomy to make decisions concerning their care, and you find that this increases their risk for abuse. I have a 74-year-old that really had required knee replacements 5 years ago, but has remained wheelchair bound because none of her 4 children can give her 2 weeks of their time to spend time with her in the hospital to be able to get her knee replacement. So this level of dependency on family members is making our older adults not age as well as they can, or not getting the adequate care that they need. There's the poor prospects for continued engagement. Our communities now are not giving the due respect to older adults as custodians of culture. In fact, we know of communities where they are being regarded as witches and wizards because they have lived to be 80, 70, especially where they have mind issues like dementia, which affects their cognition and daily life, or acute conditions like delirium, acute confusion. So all of this are the realities of older adults in Nigeria. I mean, this list is not exhaustive, but it gives you an idea. What are the global responses to aging and why really is there a global strategy? So since the 80s, we have the Vienna Action Plan on Aging that was put together in 1982. And in 2002, there was the Madrid International Plan of Action on Aging that has been reviewed severally. But recently, we have the Global Strategy and Action Plan on Aging from the WHO. And the reason is that aging has become a current 21st century trend. By 2015, there were 900 million older adults above the age of 60 globally, and that number is going to be 2 billion by 2050, by which time there will be 1 in 5 people in the world will be 60 and above, and would have many more people over 60 than we would have less than 14, which has, if you look at the population pyramid, over the years, we've always had a bulge at the lower end, but by 2050, we're going to have many more above 60 than we would have below the age of 14. So it's a big issue. What facilities are there to take care of this aging population? We must look at aging as an opportunity, but I think in environments like ours, we're looking at it as a challenge because we think every older adult brings on a burden. But if people can remain healthy as they age, then we can harness that opportunity of making, harnessing their skills, their knowledge, and being able to have them give back to society. They can help us with workforce gaps, where you can still have a 70-year-old doctor being able to continue to provide services, say in the rural areas. You know, we have people who are retired today, but we don't have any data to say this is where we have more retirees as doctors or nurses or lawyers, and you can use such individuals or such experts in their local communities to provide care to older adults and to the younger ones as well. So this strategy really, making governments focus on issues of healthy aging, so that as the world ages, people are healthy to continue to keep engaging with society. And this came out of the resolution of the World Health Assembly in 2017, and it was really to renew the commitment. So MIPA since 2002, and a lot of member states had still not domesticated the recommendations of MIPA, and the GSAP came to really renew that attention on the needs and rights of older persons. And the older persons have a right to health, and that we should highlight their skills, their experiences, and see how they can continue to potentially contribute to society, and ultimately ensure that there's security as people age. And the goals of the strategy are really that we maximize functional ability. Functional ability and quality of life are two critical elements that we look at as we take care of older adults. So we need to look at their health-related attributes, those things that will enable them to be and to do what they have reason to value. And what this means is that they must be given that autonomy to make decisions for themselves. I find that some of my older adult patients have children who are so domineering, and they just want to keep making decisions for their older adults, even when they are not cognitively incapacitated. So we need to give them that room, the autonomy, the respect. The other goal for the strategy in the next 5 years is that we fill up the evidence gaps. There's a need for data. How many older adults do we have in Nigeria? Yes, we say we have 15 million, but what's the profile of this 15 million older adults? Where are they situated? How many are disabled? And how many are experts in what fields that could be used to continue to contribute and engage with society? There's also a need to establish partnerships. This is not something governments can do alone. So partnerships with CSOs, NGOs, to ensure a decade of healthy aging. So the WHO has designated the year 2020 to 2030 as a decade of healthy aging. And this is really just so that we can pay specific attention. Government should make adaptations and investments to foster healthy aging. And I'll tell you some of the things that the Nigerian government is doing. There should be technological innovations to foster healthy aging, engaging various civil societies, communities, and the private sector in policy and program design and delivery. And that at the end, we're able to reap the benefits of healthy aging for the society to grow. So what responses do we have from Nigeria? We've had a lot of policies over the years. They just haven't been implemented. There have been bills from the different assemblies, by lawmakers that would, at the lapsing of the span of that assembly, the bill becomes moribund or dies. So we have had a lot of instruments that have not really been concluded to get to the point of being implemented. So there was the National Social Development Policy in 1989 that made provisions for care of older persons that really haven't been implemented. We have the NCD Alliance. So NCD stands for non-communicable diseases. If you go back to what I said about the decade of healthy aging, governments should have programs to foster healthy aging. NCDs are very common conditions that we find in older adults. They include conditions like hypertension, diabetes, stroke, cancers. The government actually came up with an NCD alliance, a group, multi-ministerial, multi-stakeholder group to reduce the burden of NCDs in the country. And it's a beautiful document that they've actually come up with. Again, using the life course, including how much physical activity children should have in school to reduce obesity, because we're beginning to see childhood obesity, which is giving us early onset type 2 diabetes in young people. Diabetes in young people was always thought to be from type 1. We're now finding type 2 diabetes in adolescents because of obesity from lack of physical activity. So this document, the NCD Alliance, is looking at life course approach, nutrition for children to be optimal as they grow older, ensuring vaccination for diseases that are that could be, their burden can be reduced with vaccination. So if we really can implement this, it's multi-stakeholder, multi-ministerial, if we can implement this, it would really go a long way to make sure that as Nigerians age, we're healthier. There's a healthy aging policy document that was launched in December 2008. This was actually at the instance of the Committee of Chairmen of Tertiary Institutions of Nigeria in collaboration with the Federal Ministry of Health. Again, a beautiful document that needs to be implemented. Part of provisions of that healthy aging policy document is that every geopolitical zone should have a geriatric center. So this, I know they've been doing some scoping programs towards being able to achieve this. Hopefully we can replicate the Tony and Nene Geriatric Center in the other 5 geopolitical zones of the country. There's also the National Aging Policy document. It has remained a draft since 2008. It's been reviewed, over the years. The last review was actually done last year. I was a member of the team that reviewed that document. Again, we had people represented from different sectors of government, employment and labor, civil society, Ministry of Women Affairs, the legal, so all of the different stakeholders that are involved in aging issues, we're all there. And we've reviewed this document. Ministry of Health, Development Partners, WHO had actually sponsored that program. And so that document has been enriched. We are still waiting to have it become a finished document for implementation. The President assented to law and act for the establishment of senior citizen centers in 2018. That was again a major development in the area of older adult care. We're still waiting for implementation of that. There have been bills. In 2016, there was a bill. There was actually a bill that went through public hearing for the regulation of the establishment of older adult homes, so residential facilities for older adults. Of course, with the lifetime of that particular assembly lapsing, this bill will need to be reintroduced for it to become law. The Federal Ministry of Health also has a manual for management of older adults at the primary healthcare level. They have, indicated basic services that must be available in every primary healthcare center. If we look at the multimorbidity burden, we did a survey, or we looked at our cohort of patients at the National Hospital, and this is similar to what other facilities have found. 75% of our older adults had 3 coexisting conditions: diabetes, Hypertension was number one, diabetes, and degenerative joint diseases, like knee, arthritis, lumbosacral spondylosis. So at the primary healthcare centers, this common morbidities in older adults should be able to be recognized and treated. First-line treatment given to them, and those who are complicated can then be referred to the secondary level. Issues of vision should also be able to be identified. Hearing impairment, mobility issues, we should be able to identify at the primary healthcare level. So there's a need for capacity at that level, but at the minimum, these common conditions in older adults should be identifiable at our primary healthcare centers. And that's why this manual was produced by the Ministry of Health. There is the HEPIC-C project of the Ministry of Health being led by Dr. Said, who is really very passionate about aging. In collaboration with the University of West London, they have actually been training healthcare workers. Currently, I think we have 2 doctors there who are running a master's program. More recently, or most recently, actually, sometime this week, there was a public hearing at the Senate Committee on Women Affairs, looking at the bill on the rights and privileges of older adults. Again, a very welcome development. This bill is quite rich. A number of us were there as stakeholders to make our input to make it more robust. For me and for a lot of stakeholders, our concern is implementation. So we do have a lot of instruments, but when they do become law, this current bill has a lot of thematic areas that have been taught: transportation rights for older adults with transportation, both road and air, to be able to be given discounted fares, their rights in banks and other settings where there's a queue that they should be prioritized. All of this have been stipulated. Rights for healthcare, for them to have universal healthcare coverage. All of this have been stipulated in this bill, and if really it does become law, it will be a very welcome development for aging in Nigeria. So this is just to show us the NCDs, and so diabetes, heart disease, and stroke, cancer, chronic lung diseases. So the interventions to reduce them are what you see below the tree, that will reduce alcohol abuse, tobacco use, unhealthy diet, and people remain physically active with aging. This was the launch of the Healthy Aging document in 2018 here in Abuja. So apart from the government, there have also been responses from NGOs and government, state governments, ministries, departments, and agencies. So the West African College of Physicians, which is one of the 2 colleges for training doctors to become specialists in the sub-region, so Nigeria and the other West African countries. The second college that we have is the National College. The GSAP in 2017 included geriatrics as a subspecialty. So meaning now being able to train doctors locally to become geriatricians, because all of us who practice currently in Nigeria were trained abroad. And I'm excited to report that we have our first indigenously trained geriatrician that emerged this October 2020, Dr. Francis Enebe. So it's a welcome development. We're super excited about it. We hope that we'll be able to have many more young doctors pick up the interest to train as geriatricians. The Dave Mokaro Foundation has been a leading NGO in increasing awareness on aging issues. They've also been building capacity through training and advocacy programs, both for the relevant staff, or the staff of the relevant ministries and agencies of government who are charged with aging issues in the country. Tertiary institutions also continue to do some certificate training, again, exposing all the different experts, nurses, physical therapists, and pharmacists to aging issues. I mentioned the HEPIC-C project earlier. State governments, The Delta State government gives free healthcare for those who are 70 and above. Agbation project I already mentioned to you, and then the Ekiti Social Security allowance. Development partners have also helped in the response of the government towards aging. WHO has been quite instrumental. We do have a technical working group on aging, which is multi-sectorial, but we need to expand the composition of that group and make it more functional. At the UN IDOP celebration by the Ministry of Humanitarian Affairs and Social Development, which is where aging is now domiciled. It used to be Women Affairs and Social Development, but now it's moved to this other ministry. The new Director of Social Development is really very, showing commitment towards ensuring that the TWG on aging is made more functional. And hopefully through that working group, we can also push to ensure that the aging, national policy on aging sees the light of day. So having said all of this, what are the challenges that really might make it difficult for all of this to happen? We still have the lack of adequately trained personnel, both for their health and social needs. We have the issue of data. There's the lack of implementation of even existing framework. The WHO has the Integrated Care of Older Persons document, which is a guide, very simple to use, and this can be deployed at our primary healthcare level to ensure that at the community level, older adults remain healthy, functional, can engage with the community, and we can harness from their skills and knowledge to make contributions to the community. There's a lack of synergy between the different sectors that are required to address aging. All these different ministries and agencies, you find sometimes working in silos. Or if we can bring them all together, and hopefully through the TWG on aging, this can happen and build more synergy. Nigeria is dealing with several issues of poverty, youth unemployment, and so you might find that the issue of aging takes a back burner, like not priority on the list of things. But really, if we look at it as an integrated approach, putting money towards aging is not a waste, but rather an investment. Funding gaps, a big challenge, and the fact that communities are yet to be inclusive and age-friendly, and of course the lack of policy to regulate home-based and long-term care facilities. We're seeing teams coming up to provide home-based care without any government regulatory framework to guide them. In fact, there's a lady who set up a long-term care facility, but at the point of seeking accreditation, because there was no framework to guide the accreditation process, she was recommended to upgrade to a hospital because that's what they have a framework for accreditation for. So these are still challenges that we're facing in the country, and hopefully we will be able to resolve them. So in conclusion, older adults in Nigeria face multiple challenges, the medical, psychosocial. There are available global instruments to address aging issues and improve the well-being of older adults, and this should be adopted by the government. Hopefully the recommendations of the NCD Alliance will be implemented across the board to help Nigerians remain healthy as they age. The existing local instruments should also be implemented. Our healthy aging framework that was launched by the Ministry of Health, the basic services manual for primary healthcare centers. And really, we need to get the aging policy draft to become a finished document. Bills to become laws to ensure non-discrimination of older persons and curb elder abuse. And if other states can emulate the Agbation project to be replicated across the country, universal health coverage to include older adults and include the different conditions that they tend to suffer from. So health insurance that will cover for cancer treatment, health insurance that will cover for trauma, health insurance that will cover for palliative care, long-term care, even if it's not 100%, but we need to have some guide on being able to provide insurance coverage for all the different, for the care of older adults at the different settings. I know that currently the NHIS has a contributory platform where anyone, including an older adult, would pay 15,000 naira a year and you get coverage for the year, and this can be replicated yearly. The Ministry of Health under the HEPIC-C project is also looking at being able to continue the insurance for retirees after the age of 60 on a contributory level, so there's 15,000, and after the age of 70 becoming non-contributory. So the health insurance issue is key so that people are not impoverished by paying out of pocket for healthcare. In the words of Abraham Lincoln, and in the end, it's not the years in you that count, it's the life in the year. So as geriatricians, we're very concerned about putting life in the years of older adults, making sure that it's good quality life. And I hope that all of this policies and programs that government would eventually bring to fore would help us to put more life into the years of our older adults as they age. Thank you very much for your time, and again for giving me this opportunity.
Thank you so very much, Dr. Ogugwa. I am tempted to stand up and give you a standing ovation.
Did you?
That was excellent. I mean, super excellent. So I want to quickly speak the mind of everybody technically, if you will be ready to share those powerful slides with Dagomo to share with participants. I mean, that was excellent. I don't know if that's something you wouldn't mind sharing.
Yes, I can certainly do that.
Oh, thank you very much. Thank you so very much. I mean, that was a very excellent delivery. You have touched virtually every area. You identified clear areas of gaps. You talked about current interventions that have probably been done and are ongoing. And then you also looked at the challenges within the sector. And then you gave a very powerful recap around the topic. Just to say that Dr. Ogugwa actually looked at it from a health perspective as a geriatrician, and she did a very excellent job at that. So for those of you who probably want to, get these slides, please drop your details in the comment section or in the chat section, and our IT would compile and collate them for sharing. Once again, thank you very much, Dr. Ogugwa. She's a medical doctor and a PhD doctor, just so that you know. All right, so like I said, you can also have your questions too by the chat. So maybe since the questions are going to come at the end, we are going to, you could probably write your details at the end at the chat box and then keep your questions, because we're going to take the questions for both speakers. So it's important that you just remain attentive. All right, before we take in the second speaker, Dr. Ogato, we'll just do the second polls. We did the first polls before, and so the polls are basically to help us gather data and sample opinion around the topic. So the questions will pop up on your screen. It's expected that you will click the choice answer and then you submit, after which we collate and then we'll move on to the next speaker. So at this time, I'm going to invite my colleague from our Abuja office, Mr. Luke Alade, to take us through the polls, and then we'll have the next speaker. Then we'll entertain questions, answers, comments from across the board, and hopefully we'll call it a day. All right, Mr. Luke Alade, please.
Thank you, Mr. Ohimwen. Thank you, everyone, for joining us today, participating in this webinar. So we'll take the second polls, and like my colleague has said, It's basically just to test or to know our ideas on certain subjects. So please, Mr. Oreo, could you help us display the polls on the screen? The polls will be displayed. They will have series of, it's a question and it has series of answers. So please just pick an option. What is your level of awareness on the existence of an elder care policy in Nigeria? How much awareness do you have that there is an elder care policy in Nigeria? 1, I am very certain that there is an existing elder care policy. In Nigeria, there is no national social security system to provide an economic buffer in old age. I am not aware of the existence of an elder care policy. I don't know what an elder care policy is. So please just pick an answer and click on the submit button down here. There's a submit button here. When you read through the question and the answers again, you can just pick one and click on the submit button. We have 1 minute to do that, please. Thank you. I expect that by now we're already imputing our answers. Just with the question, it's we don't want to, we're not particular about how certain you are. We just want your opinion. So please just impute your answers and click on the submit button. Okay, we have 10 more seconds to go and we'll display the results of the poll. What is your level of awareness on the existence of an elder care policy in Nigeria? Are you very certain? Are you saying there is no elder care policy? Are you not aware? Or you don't even know what an elder care policy is? So we have 5 more seconds to round up. Okay, thank you for your inputs. Thank you, everyone. Mr. Oreo, please, could you help us display the responses to? So here's our response. 70% of us said we are very certain that there is an existing elder care policy. Wonderful. 70% of us is saying there is no national social security system to provide an economic buffer in old age. And 67% of us, the largest number, is saying I'm not aware of the existence of an elder care policy. Thank you. So the second question for the first polls, please, Mr. Oreo. To what extent do you agree that an elder care policy is needed? To what extent do you agree that an elder care policy is needed? Do you strongly agree? Do you agree? Do you disagree? Or you strongly disagree? So to what extent do you agree that we need an elder care policy in Nigeria? And if you're thinking of how to answer the question, you can think back on what our first speaker discussed and you know what to say. So please just pick a response. You don't have to be accurate as always, just what your thoughts are. Share with us, please. We have 30 more seconds to impute our answers. 20 more seconds to go. To what extent do you agree that an elder care policy is needed? Okay, 5 more seconds. And don't forget to click on the submit button when you decide on a response. Okay, thank you. Thank you everyone for participating. Mr. Rio, please, the response to the polls. So 93% of us actually strongly agree that we should have an elder care policy in Nigeria. And just 7% of us agree, but at the end, we all agree that there should be an elder care policy. Thank you. So the third question and the final question for the first poll. What area of need will an elder care policy be most impactful to the elderly in Nigeria? What area of need will an elder care policy be most impactful to the elderly in Nigeria? Is it in social needs, health needs, psychological needs, financial needs, all of the above or none of the above? So in what area do you think is going to be a lot useful in social needs or in health needs or in psychological needs or in financial needs, or you'd rather prefer that we have an elder care policy in all of the options we've listed above, or you're saying it's absolutely not necessary? So we have 30 more seconds to input our answers. Don't forget to click on the submit button, please, when you're done. 10 more seconds to go. I'm sure by now we have all of our inputs. I would just encourage 1 or 2 persons that haven't submitted yet. Just need your opinion, your thoughts. Okay, thank you everyone for participating. So please, Mr. Oreo, display the last responses to the poll. I can see that 93% of us saying all of the above. That is, we need elder care policy in social needs, health needs, psychological needs, financial needs, and 7% said we needed more in health needs. Thank you for your participation. I would hand over to Mr. Uhimwen, who is our moderator for today. Thank you, everyone.
All right, thank you, Luke, very much for that post. All right, kindly allow me to adjust the program a little bit to accommodate Dr. Ogugwa's schedule. She has an AGM meeting shortly. So I would like us to quickly, if we have questions for her or comments around her presentation, we can just quickly take that now so she can leave for her AGM meeting. And then we'll take the second speaker and then we'll have questions for him. So if you have any questions or comments around Dr. Ogugwa's presentation, that would be this is your time. Either you type it at the chat box or you kindly quickly unmute yourself and keep it short and simple. Joseph has said in the chat, but that was an excellent presentation. Ruth Ojumo says says if they can get the presentation. Yes, we have said that. Just looking through the chat box. Mary Igaro is commending the presentation, good presentation. You will get the presentation as you drop your details with us. All right, any questions across board or from anybody for Dr. Osi Ogugwa? Yinka Obalande is saying excellent presentation. Thank you, Yinka. Joseph Origo wants to know how soon might we get an elder care policy? Yeah, so doctor, how soon is, I think Joseph wants to know how soon we can get an elder care policy. So Dr. Ogugwa, that's for you.
Right, I really wish I could put a time frame to it, but let me just say at least that aging policy document went through a rigorous review in 2019. And really, maybe if not for COVID, it would have made some progress by now. So let's hope that this is something that can happen within another year. I know the process, it takes a while, as we all know, with government. But really, what I feel we all have some interventions we can make at our own different local communities. So I talked about the basic services manual from the Federal Ministry of Health. Just walk into your primary healthcare center in your local government area and find out what's going on. What are the staff doing there concerning this manual? And if it's not available, really we can work on being able to make it available from the Federal Ministry of Health, and hopefully make e-copies available that we can all use as an intervention at our local government primary healthcare center. So really, we need to show interest. We need to, so as many of us as would go to those primary healthcare centers and ask questions about, what are you doing for older adults? This manual exists, do you have it? Do you have a blood pressure machine? Do you have a machine to measure blood sugar? Do you have facilities to check vision, hearing? Simple things. Primary healthcare centers, age-friendly in terms of design. The man who has a wheelchair, is there a ramp to be able to access that center? The one who is using a walking frame, is there a ramp with a rail? Because these are some of the reasons why they don't even use these facilities, because of the discrimination. They can't have access because it's not designed to allow them access. So these are some of the basic things we can do. And really, majority of our older adults are rural dwellers. If our primary health care facilities can be ramped up to function, it would help a lot. At that level too, they're supposed to give them health education about health promotion, nutrition, physical activity. And these are simple things. They really don't take a lot of money, but it's to make sure that the personnel who are there have this knowledge and skills, and they also treat these older adults with respect. Because again, that's another reason why our older adults do not want to come to the hospitals, because they're not given the due respect by staff. Some already say, oh, Mama, you're 80 and you can't see. It's because you're old now. Age is not a disease. It increases the risk for diseases, but it's not a disease. And that 80-year-old still has a right for medical care. And facilities must be that age-centered, age-responsive, to provide that respect for older adults.
Okay, thank you, Doctor. So I'm going to wrap all the questions together. So I will need you to just take notes so we can allow you to move. So I'm seeing Dr. Biola Mohammed wants to know, I think you have even touched part of it in your talk. He wants to find out where should the emphasis on action be? I know there needs to be a multidisciplinary approach, but where do we think senior energies should be spent first? I guess he's talking about in the approach in geriatrics, as it were. Then that's for Dr. Mohammed. Joseph wants to also know, are there any processes to monitor implementation of policies? Okay, that's for Joseph. I think Dr. Biola is making a follow-up to his question. Also, he wants to know where we can get information or guidance. Should we want to put centers in place? Maybe elder care centers, where can we get information or guidance? I think that's a very simple one. And then I think those are the three questions we have, and probably, okay. Can you, I don't know if you can take the three, or if you can access the chat box, probably you can let that guide you going on. So I'll allow you to have the floor again to just respond to those questions.
Right, so I'm looking at this, asking about where emphasis should be. Really, if we go back to the fact that if you're healthy, you can continue to engage and contribute, that would be my recommendation, that we put a lot of emphasis on keeping people healthy as they age. But let's also bear in mind that there are several determinants of health. So the social security for older adults is a very important element for them to remain healthy and ensure that they're not poor. So those would be the two areas for me, that we provide universal health coverage for older adults so that they are able to afford health care and to remain healthy, and the social security to give them some element of economic empowerment.
Okay.
And for there's a question about where to find information and guidance to put up centers. Really, like I did give you that case scenario where someone built a center but could not get government to accredit her as a long-term care facility. Exactly. Because they currently do not have a framework for accrediting long-term care facilities. So that's still a challenge, and hopefully the HEPIC-C project under the Ministry of Health will be able to deal with that. But right now, if you want to set up a center, you still have to go through the Ministry of Health, and because aging is domiciled in the Ministry of Humanitarian Affairs and Social Development, you would also have to involve them. But the Ministry of Health is a key ministry to be involved as you plan such a project.
Monitoring of policies, anybody's, there are no even policies, so there are no.
So yes, when the policies do, become fully implementable, then the relevant ministries that have put the policies in place. Again, there would be a need, because there have been conversations about setting up a commission.
That's right.
For older adult care. So if that would happen, then that would be the commission would then have that role of monitoring the implementation of the aging policy. But where the commission is not established, and I know this came up during the hearing at the National Assembly a few days ago, government is already spending so much on administering, governance. So establishing a new commission might not really happen, but rather domicile. For instance, this bill on the rights and privileges of older adults might just be given to the Ministry of Humanitarian They have a unit
when I wake up,
of supervising. So that's the way I think it might eventually play out. So if if you then came across an infringement of the regulation, then it would be that ministry to actually report a situation to.
All right, because of time, we'll just quickly wrap up. Somebody wanted to know about whether we have some documents at the state level. I think that's individual to state. For Edo State, for example, there's already one that Dagomo is championing at the state level for elder care policy. But right. I think Dr. Ogugwa talked more about she looked at it from a national point of view. So different states may be starting up something, but for Edo State, I can assure you that we have already gotten to a very advanced stage in having an elder care policy. And there's nothing stopping other states from, putting stakeholders together to start demanding for elder care policies in their various states. All right.
Absolutely. So, I see something here about a curriculum. So the curriculum
yes.
I mentioned for the West African College of Physicians,
who has that?
Which is for training doctors to become specialists in geriatrics. Exactly. One way we would need to fill the capacity gap is that we get geriatrics in the training curriculum of all the different healthcare workers. So medical students, nursing students, pharmacy students, social work, all of those should have geriatrics in their curriculum so that we can build capacity quickly in that way. Thank you very much, Barrister Dan, for your time. I really need to get back to the AGM. This has been interesting, and I wish you fruitful deliberations going forward.
Thank you so very much. We appreciate you so very much. Clap, clap, clap. Thank you very much, Dr. Ogbu. So that was very insightful. So we'll just move on. We've done our poll. So the second speaker is already waiting. So I'll just quickly introduce him and then I'll allow him to take the floor. Dr. Ekoswehi Ogato is a senior lecturer and researcher. He teaches health and care policy in the University of Benin, Benin City, human resources in the healthcare and strategic healthcare management in the graduate programs in healthcare administration in Institute of Public Administration and Extension Services in the University of Benin. He is a team lead in the development and policy multidisciplinary research cluster, which research interests span healthy aging, lifelong learning, and elder care policy. He's currently researching non-state actors in healthcare delivery for the elderly in developing economies. Dr. Ogato is well published both locally and internationally, and has made regular appearances at professional and academic conferences on gerontology development over the lifespan and other development-related issues and discourse. He's a member of the University of Benin Research and Publication Committee and holds membership of several professional associations, which has facilitated networking with other academia and professionals in healthcare delivery. He has been very resourceful to Dagomo Foundation. I just spoke about the policy drive of Dagomo Foundation. He was a very pivotal person in pulling that through, and we are using this opportunity to also say thank you for your contributions so far. So without wasting much time, I'll just allow him now to talk on the topic, but he's going to look at it more from a policy, point of view as against the health perspective. He's going to look at it more policy. So in the next 20 minutes, you're going to be hearing from Dr. Ekoswehi Ogato. You have the mic, or you have the stage, sir.
Thank you very much, Dr. Dan. It's my pleasure to be here.
I'm not a sir.
Okay, Barrister Dan. Okay,
Yes.
Dan Esquire. Thank you so much. I want to thank you for putting this together, Dagomo Foundation. And we've done quite a lot of work, as you have said. In fact, my discourse this morning invariably takes its strength from the poll that was just conducted, where we have almost 93% or 93% saying they are not aware of a policy or there's no existence of any policy. You see, that is what it is, really. That's a reflection of the situation. And to that extent, all the good things, all the realization as pointed out by all the benefits that were accrued to the nation in managing, effectively managing the elderly persons can only come to be when there's a viable and sustainable policy. And that takes us to the issue of what do we mean by policy? Simply put, there are different conceptualizations of the concept of policy or public policy, as the case may be. But one apt one that I want us to run away with is the fact that a public policy is what government chooses to do or not to do. Because when government decides not to do something, as the situation is with the issue under discourse, it is a policy in itself. But what we are saying is that the public sector, the government, has a role to play in driving the desires of that particular government. And we have the previous speaker and maybe others before in our different fora have emphasized the need, even the poll just conducted, emphasized the need for a well-conceived elder care policy that will be comprehensive and multidisciplinary from what they said. It's not only health needs, we have financial needs, we have social needs, even sports needs. And as you rightly mentioned, we are happy that the Dagomo Foundation is taking a foremost position in ensuring that we realize something that is really worth the whole idea. Now, before looking at the impacts of policy on elder care generally, I've also mentioned the fact that policy simply indicates the goals. It's futuristic, if you like, as to what is it that should be done. What should be the signposts that should guide whatever actions that should be put in place by various sectors, not only public agencies, private agencies, non-governmental organizations, and all others have a role to play in ensuring that older persons are adequately taken care of. Maybe at this point, I should mention that even in the African sub-region, countries like, it's disheartening that in our country, up to date, it's still story upon story. Madam just alluded to a 2019 document and some others. We've been hearing such. It means, but though it is perhaps heartening to hear that only last week, or within this week rather, there is a bill now before the National Assembly, which specifically talks about the rights and privileges of older persons. But that's just a minute aspect of a comprehensive policy. If you, just like we did when we tried to conceive the Dagomo project, or when we worked on the Dagomo project, you find that countries like Tanzania, Kenya, South Africa, not even talking about the Western-based countries like Canada and others, they have a very, very comprehensive document that specifies what should be done, what the objectives are, very clearly put together. So at this point, what does the policy process imply? As I've mentioned earlier, a policy involves a sequential pattern of action, and it involves several stages. That is why when we look at the heuristic model of policy making, you have three aspects that you can easily discern. First, you have to conceive of the policy, which is the policy formulation stage, wherein the stakeholders contribute tremendously to characterizing what we think older persons require, of course, based on research and all that. Then, of course, we go to the issue of implementation. We are not even talking about implementation here now because we don't even have a subsisting policy. But let's mention it that implementation phase is another serious aspect, because you may have a very robust program which specifies what should be done, the way and manner older persons will be assisted to access health facilities, social facilities, psychological facilities, financial, whatever, counseling and all that. But the implementation framework, and that is why the Dagomo document, once it comes into the public domain, it will assist. I had some people asking questions if they want to start such elder care programs, what should they do? I think this Dagomo project addresses everything, starting from the needs assessment of older persons, as well as the provisions for them and what should be done, and the implementation framework at various levels. It is broken down into several stages to help with the implementation. So the point I'm making is that there must be a clear-cut implementation strategy for any policy to become meaningful or to achieve the purpose for which it was set up. And finally, we have the feedback and evaluation. I'd like to digress just for a minute. You find that Nigeria, our country, as well as some other developing countries, actually cannot be said to have lost sight of policies. In fact, what we have in our case here, especially in the social sector, is what I might refer to as policy somersault. You find that you have several policies that are neither implemented properly according to the letters and spirit of the document, and above all, nothing is even done about the issue of evaluating such policy over a time frame to ensure that whatever is put there or whatever is implemented is assessed to find the extent to which the goals are being met. Remember, I said earlier that at the formulation stage, we have goals clearly delineated. So it is only important that after implementation of such policy strategies or guidelines, then the next thing is to seek to assess whether those objectives have been mentioned, have been achieved. But that, hello? 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 Okay, that these policies are put in place. So briefly, what we are saying here is that a policy is a serious document that when evolved, because of the stages it passes through, I've said several stakeholders are involved and there are various stages. In fact, under the policy formulation stage, there are several activities which involves stakeholders taking decisions as to what should be done and how it is to be achieved. And so we can clearly see some stages, the stages or the steps in this stage to involve first and foremost goal formulation, which involves involving multiple groups with varying and often conflicting objectives because they have various ideas. Then we need to identify the problem identification stage and definition, because you've been able to delineate what the issue is. Then we have the agenda setting stage, which involves several stakeholders. And we have several alternatives that emerge at this point and all that. But the point we are saying here is that now, the major crux of what I've been asked to discuss, I mainly talked about the stage of the 3 stages of policy formulation, policy implementation, and finally the issue of policy assessment or evaluation. It's conceptualized as a circle. It's a circular flow. In which case, after the last stage, once we find that something is probably not the ideals, the goals that were formulated are probably not being achieved, then it follows that the policy, the first stage, which is the policy formulation stage, we now need to be revisited. What I'm saying here is that it is not what is cast in stone. Rather, you can reformulate based on ideas from the field, or you revisit stage 2, which is the policy implementation and all that. So these are all the stages that we look at when we discuss the policy process. But again, and it is good to mention that.
Well, just listen to you and enjoy it.
Hello? Okay. So what we're saying here is that why do we need a policy? What is the policy impact? Or what should be the policy impact on older persons? That's the question that begs for an answer. And I like to say here, first and foremost, that we have said here that a policy is what the government chooses to do or not to do. And so what this simply means is that if we don't have a policy, a well-articulated policy in place, then invariably the expectations of the policy in terms of its impact on the beneficiaries, and in this case, older persons, will be jeopardized. And that's the situation we find ourselves right now, in the absence of a coherent policy in place as an official document. But it is our desire that a well-articulated policy should be put in place to attend to this important segment of our population, the older persons. I'm sure in the last discourse, by way of conceptualization, most authorities believe that people who are 60 and above fall within the older persons group. And we have been able to establish too in the literature that older persons are not completely spent forces. Rather, they constitute a very important, if you like, call it repertoire of knowledge and expertise. They are still capable of living very useful life. I'm happy the last speaker mentioned that somebody is old does not mean that that person is completely written off. No. In fact, in the last population segmentation, they are more than the active working stage. And of course, we know that in our country here, most people who are contributing, who are the drivers and shakers of the economy, the social sector and all others, they fall within this age group. So they need to be taken care of, just as the younger ones are also taken care of. But the point we are making here is that when we have a policy in place, which is highly desirable, and once again, I want to congratulate Dagomo for spearheading this in Edo State, because that is the only concrete evidence of any policy that we do have, perhaps now, you know. Others are just mere aspirations, aspects of what a comprehensive policy should be. So, talking about what is the expectation of a policy, first and foremost, talking about its impact, it will provide, when the policy is in place, accepted by the government of the day and by the stakeholders who have keyed in, both the private and the private sector, both the public and the private sectors, as well as the NGOs, corporations and all that, you find that it now provides a signpost. It provides a very clear direction for everybody to pursue. The advantage of this is that coherent strategies will be put in place. The necessary infrastructure will be put in place to attend to the needs of this very important segment of our population. So you find that a policy is indispensable, no matter the way you want to look at it. Otherwise, you will even find charlatans, people who are not even, I mean, that's a very common phenomenon in our country, yeah? People who don't even know the basic concept that is involved, coming in, and of course, as is usually said, when you have too many hands in preparing the pot of soup, perhaps what will come out may not be as palatable as expected. So, in terms of policy, the fact that a policy is desirable and is indispensable cannot be overstretched. But what we are saying here is that it will help both the government or the providers generally, whether in the private sector or in the public sector. It will give them very clear directions as to what to do for these older persons. It will also provide the machinery. It will provide a basis for continuity. Remember the point I tried to establish earlier, that one very important aspect of a policy document is the issue of sustainability. We have had several policies in our country where after 1 or 2 years, the policy goes into oblivion, and that's not good enough. But we are saying that by the time there's a clear-cut document which has been generated from what we refer to as bottom-up approach, from the stakeholders, from the when I talk about stakeholders now, not only the providers, the care providers, we are also talking about the older persons themselves. They should be involved in crafting the policy. What I'm saying is that they must have made their serious inputs into what they think are their needs and how they think their needs should be met and should be catered for. Otherwise, what we have in our socio-economic milieu is the top-down approach. And in development studies and all that, we have seen that the bottom-up approach is a better approach to policy and planning. You involve the recipients, the beneficiaries, so that by the time they see it as their own program, then the likelihood of success is guaranteed. So that is one. And of course, the whole essence of a policy document is the issue of quality assurance. By the time there is a policy, we are not sure that we can bring about quality in terms of the delivery to these older persons. Another characteristic that we can not fail to mention is the issue of direction. With a well-articulated policy in place, it makes it easier to have a clear-cut direction for all stakeholders in terms of presentation and in terms of the actual activities that are involved. Otherwise, you find a situation where it's an all-common affair and everybody begins to run from pillar to post. At the end, what was supposed to be of positive consequences for the older generation may even become quite negative, which should not be the case. Another impact that a well-articulated elder care policy can engender is the issue of connectivity. What I mean by that is that all the agencies that are involved will have a basis for them to relate, to cooperate, to collaborate. And what is the essence of all this? They can share information. They can share information as to what to do. They can share strategies that have worked. At the end of the day, once this is properly put in place, you find that the other persons, that is the recipient, stand to benefit. But in the absence of a policy, a good policy at that, a well-articulated policy, you find that there's no relationship, no interconnectivity, no collaboration. And in that kind of situation, what we can expect is something very terrible, as the case may be. So in essence, therefore, what we're saying is that with a policy in place, we are guaranteed of performance improvement. How do I mean? With a policy, goals are stated, objectives are well delineated, strategies for implementation are put in place. So, as I mentioned earlier, at the stage of evaluation, assessment, we are now in a position to know what strategies to put in place by way of performance improvement. And if such strategies have not been working, then the goals can be reformulated, or the strategies can also be reformulated. So we also find that the issue of performance improvement can only be guaranteed from a well-articulated elder care policy. And those are some of, and at the end of it all, they all dovetail into very effective and proper delivery of services to older persons. And of course, it is also significant. It is of utmost importance that a policy is in place. So, perhaps the question may be asked, since I say it is what a policy implies what a government chooses to do or not to do, the question may also be asked, is it possible that we also have, when the policy is in place, that it could also bring about negative impact for older persons? Well, yes, and that comes from the fact that a bad policy in any sphere, be it in elder care policy or in any social, cultural, or business sector, a bad policy certainly will have or may engender negative consequences for the beneficiaries, as the case may be. But the good thing about it is, it's better to have a policy than not to have a policy. Because it is possible that what may appear to be a poorly articulated policy as of the present may eventually, with time, be reformulated to inject those aspects that will assist in ensuring that the expected dividends of that policy that will benefit older persons and their caregiver will eventually be reformulated. Remember, I said earlier that we cannot see policies as being cast in stone. It should be subject to review, based on any time frame, could be every 4 years, could be, depending on what the situation is. The whole essence of it is to reform and to add new values, new expectations, because these needs that we have even articulated so well in the Dagomo document cannot be said to be final. Because as life goes on, new things come about. For example, the issue of technology. We cannot assume with new technology dictating what is ongoing. Most of the older persons lived in an era when technology was downplayed, when it was not an issue. So you find that if a document was articulated then, we did not take into consideration the technological needs, in terms of communication needs, ICT. You find that in the present era, even older persons can use the computer very well. It becomes a need for them in order for them to participate actively in the social political expectations of the community they belong to. So the point I'm trying to establish here is that this cannot be said to be final. It is subject to review. So that is why once we evaluate any existing policy, new things can be injected into it. And it goes on and on and on like that. That's why most of us believe that the cyclical approach to policy making and policy implementation is it, really, though there are some others who believe that policy making does not actually follow a cyclical approach, but at least that linear approach from policy formulation to policy implementation and thereafter to its evaluation. So, in addition, it is important to mention this, that when discussing this issue of the impact of policies on elder care, is the issue of focus. With a document, with a policy document that has been comprehensively made with inputs from everybody, it indicates a focus, provides a direction for all practitioners to pursue, so that at the end of the day, the beneficiaries are there. So the issue of focus is another very important impact of policies. Any elder care policy on the people. So there are several problems. Maybe I'll quickly mention this. I don't know how much time I have. There are several factors that also impede the issue of policy, because I don't want us to go away with the impression that once a policy is in place, then we are rest assured that all the expectations will be met. No, that's not the situation. So perhaps let me just spend 1 or 2 minutes talking about the issue of policy problems. First and foremost, for the expected benefits to be garnered from this elder care policy, when it's eventually put in place, to achieve any measure of success by way of its impact on the beneficiaries and the providers, what is most vital, and this is a situation that has pervaded our political terrain for a very long time, the issue of the political will. That is a major problem for policy articulation and policy implementation generally. And of course, when we dovetail to the issue of to the issue that is under discourse. So the political will in most cases is missing. And that is why you find that most of our development partners are more inclined to working with non-governmental organizations, because there is speed in terms of attainment of the set objective of any program or project. And of course, all the bureaucratic bottlenecks, all the political undertones that are involved when in a public sector situation, it's not there with international, with NGOs generally and the private sector. So you find that the will can be said to be there in the case of non-governmental organizations. They passionately pursue whatever ideals they belong to. Again, I must mention Dagomo in this case. The passion is there to push it. There are people, there are individuals in government that will share the same passion, but the structure tends to mitigate the attainment of such zeal, you know. So because of this, because of the structure, there are bottlenecks here and there that will tend to undo such desire. And of course, funding is a major issue, you know, because in government circles, there are several considerations that tend to compete with each other. And of course, we know resources are scarce and all that. So the point I'm trying to establish is that for any policy to attain any measure of success, there must be that political will. And of course, maybe the way to run around some of these things will be by way of PPP, public-private partnership, in some of these programs and projects. That can be worked out. Government can, because government, it has been seen over time that the public sector, they are very poor implementers of projects because they have some other considerations, political consideration. So they can partner with the NGO, the established NGOs, in helping to pursue this zeal. Perhaps what is missing in the political will can be compensated for by the will within the private NGOs and all that. Another major impediment to policy implementation, articulation, and even evaluation is the apparent failure to involve the appropriate people. That has been a major issue. Again, that takes me back to what I said earlier. The issue of top-down approach to issues. No, this was the practice in the 70s, 80s, and all that in the developed world. But it has been realized that, yes, government can pursue, it's very easy to pursue this top-down approach. But we find that most of the things will not work. But when you involve the recipient, you are likely to achieve some success because they see the progress, they see the program as theirs. They will not see it as an imposition. So it is important that we involve the appropriate stakeholders, the appropriate people as participants. They should be involved. And the emphasis here is on the right and appropriate people. Because if you don't have this right mix of stakeholders, the likelihood of the policy being attaining its set objectives is very doubtful and all that. So these are some of the issues. And of course, I don't want us to take it for granted. Before any policy is articulated, there must be strategic planning. What do I mean? It must involve research. In a multicultural setting, such as ours, with so much diversities, it is not enough for somebody to sit at the central government and formulate policies that perhaps will be operational in Edo State or some other states. Because the needs of the elderly in this case might be slightly different. Because we cannot do without the cultural inputs. I agree that globalization, westernization has impacted on the way and manner, the traditional methods of caring for the elderly that was in place in our communal system of those days. But the needs are still not the same. There are slight differences, even if we can draw common themes from all of this. So what we are saying is that it is important that in articulating a policy, it must provide for diversities. Very important. And of course, a policy can also be put in place that does not actually address the critical issues that are involved. So I think the point I'm trying to establish all along is that it is not enough just to fulfill all righteousness, to say, oh, we have a policy on this and that and that. No, I'm sorry, I'm making reference to what is in place. Oh, there's this strategy, I think it was referred to as GSAP or whatever that was referred to recently. That is in the Federal Ministry of Health and all that. And incidentally, from all the comments, many people are not even aware of that. So it is not just enough to have a project in place that got so much money, so much resources, and the recipients are not aware. The practitioners are not aware. So what I'm saying is that you could have a figment, an aspect of it. But once you have a comprehensive document, it will address critical issues. And so if you have a policy, in quotes, whether it's a policy or it's a document, is an idea that does not address the critical issues, then of course that is also going to have its negative toll on it. And I think when the last speaker was responding, the issue of domicile, that asking for an agency or a commission, that should be far-fetched, given what the politicians were saying and all that and all that. They have their own needs. So they'll probably say having an agency or a commission for older persons is not serious enough because there are no resources and all that. I don't buy into that. Taking care of older persons, people who have served this country with their sweat, no matter what, whether they're in the private sector or in the public sector, they have contributed immensely to the nation state that we have today. So nothing should be too small. Oh, sorry, nothing should be too much to put in place to take care of them. So I don't buy into that. So that's what I'm saying, that the political class, the way the political class go about their business, they actually, with due respect to some of them, they are not actually concerned about issues that does not concern Naira and Kobo. They are things that will not bring any real benefit. So that's why when too much emphasis is given to economic considerations, some of us say, no, you can't isolate economic considerations, that's in terms of bread and butter, from the social needs of the people, the psychological needs of the people who are going to drive the process. And in this case, the older persons still have immense experience at their disposal to contribute. So what I'm saying here is that we could have a document that does not address the critical issues, that may just dance around some kind of peripheral attention to this thing, and it to be taken to be so. So at the end of the day, the older persons stand to lose. So it is very, very important. We have a document that can do that.
Sorry to cut in.
Of course. Yes.
Time,
okay, my time.
Yes.
I can round off now. Okay.
Yes, please.
Okay, let me begin to round off. The issue of flexibility and responsiveness to our dynamic environment is also a major problem that we have had with several social policies in the past. We need to be quite flexible. Rigidity does not help anyone in the process. We must be responsive because the environment is dynamic. I think that was the point I was trying to establish earlier, that the needs change, the objectives will equally change. The implementation strategies should equally change and all that. So these are some of the issues. And as I mentioned earlier, one major issue is that which has years to live, and there's so much that should be done. So the points I want to establish very quickly is that for the needs, or the special needs of other persons to be taken care of adequately, a policy is indispensable. And it is the one that provides the direction, it provides the guideposts for any action whatsoever. Otherwise, the approach will remain haphazard, disjointed, disconnected, and will not achieve the purpose for which many organizations are working seriously hard to take care of other persons. So a policy is desirable. And finally, I want to thank Dagomo for taking the initiative some 2 years ago now to articulate a proper policy. But I know impediments, the operational resistance by government has started the enthusiasm that was generated by Dagomo. But I think, as I heard shortly from Dan, says, well, we are nearly getting to the end of the tunnel. So finally, I want to thank everybody. I hope I've been able to sensitize us to some of my thoughts regarding the fact that a policy is desirable, other persons need it, the nations needs it. So thank you so much for listening.
Thank you very much, Dr. Ogato, probably Professor Ogato. Someone just made a side comment that you are a real lecturer. You were taking us through a class.
Thank you.
Chances are that you may come back to complete the course with us. Just to start from where you stopped, the enthusiasm hasn't dropped, and I think, like I rightly mentioned, we are closer to the end of the tunnel on our policy drive than when we started. Again, I want to thank you very much for taking us through that very insightful lecture on the issue of policy. You really touched a lot of things. You gave definitions. You talked about the need for direction, quality, the need for stakeholders, highlighting issues of connectivity, performance improvement, the need for very effective and proper service delivery as products of good policies. You talked about focus, which for me is very key. You looked at the issue of political will, involving appropriate people, strategic planning in terms of research and driving out with flexibility and rigidity. You talked of flexibility and non-rigidity of policy, and considering specifics in terms of the demographics and the needs, specific needs of older persons across places, across different divides. That was very, very insightful. I'm very sorry because of time. You know, we started at 10, we have to close by 12. So might be a little bit in a fix to take a few questions. I will only take questions that are reflected in the chat box. Outside that, I'm afraid I won't be able to take any questions. So quickly take your questions, and we'll hope to answer them as quick and as sharp as possible. While you were on, a few people dropped off, but I will not fail to mention some people that we had on this. Hajia Belkisu joined us from Bauchi. She was here all the way from Bauchi. The ASCOPIN president, the national president of ASCOPIN, she told me she would join from, I think she's in Canada or the US. So she joined, she dropped off. She apparently, she hasn't slept. She told me she was going to keep a vigil just to be here. So at some point she dropped. I must really appreciate her coming on this. The Vice President of the Stakeholders Group on Aging, Mrs. Kikumba Roslyn from Kenya joined in. I noticed her. Thank you. She's the Vice President of the Stakeholders Group on Aging. I noticed her. I must also thank you all who have stayed throughout, this course, and I'm going to mention your names. Apparently, we are not very much. Dr. Biola Mohammed, thank you. We've been seeing your contribution. Thank you very much. You may want to put in the chat box where you are, viewing from, Nigeria or somewhere in Nigeria or outside Nigeria. Alika Elijah, thank you. I know you are viewing from Nigeria, Ugbo to be precise. Thank you, Dr. Luole. Thank you, Mr. Wankwo. Thank you, Osarugwe Nehizena. I know you are from Benin. Thank you, Professor Afemike. You have been here from this very start. Thank you, Prof. We appreciate your contributions. Thank you, Ruth Ojumu. I see you. Thank you so very much. Thank you, Yinka Obalade. Thank you. We've seen your contributions. And I think the other people I mentioned were, part of the discourse before now. Also joining us is our executive director. She's also a board member of Dagomo. She's largely the reason we are here. She's the one who has motivated us to be here doing the things we do. She has been a very strong pillar or force or foundation around Dagomo. I will allow her to, take the last words to greet us, subject to no questions. So far, I can see one of the comments saying, wow. Ruth Ojumu says, wow. The lecture was very insightful. She's thanking you. All right. Aside from that, I will now call, in the absence of any further questions, I will again invite my CPO meaning Chief Program Officer, to thank everybody, and then also to introduce our Executive Director, Mrs. Ifweko Omoigbe Okaro, to give her final remarks, and that will be the end for today. All right, Mrs. Park, let's have you on again. Thank you. Mrs. Park, you need to unmute yourself so we can hear you.
Okay. Thank you so much, Dan. And wow, that was really stimulating and engaging discourse. I think it's actually encouraging for us as players in the elder care space to see all the support for this cause. Indeed, I would say that there is hope for Nigeria to actively participate in this decade of healthy aging. We actually look forward to government choosing this policy by not only putting it in place, but also implementing it both at the federal level and even in Edo State. And again, it's interesting that Nigeria recently clocked 60. So I suppose we could say that Nigeria is a type of older person. So we look forward to more intentional action in the space of care for the rights and the privileges of older persons. Dagomo will continue to champion this cause even beyond Edo State. We would like to call on influencers, some of you who are here with us today, if you can support in championing a similar bill in your state to work with us to make this happen. We would really, really appreciate that. And it's also refreshing to see the interventions in Osun and Ekiti State, as Dr. Gugwa said earlier. We certainly have them on our radar to talk to them about policy implementation, policy adoption very soon. So as Dr. Gato said, policy is indispensable, and we the experts, we need to own it so that it doesn't become an all-comers affair. Thank you so much, Dr. Gato and Dr. Gugwa, who had to leave. We really appreciate your time and support. Thank you to our distinguished delegates. As Dan said, we appreciate you for being here. It means this is a priority for you. So on that note, I would like to wish you a pleasant day, what's left of your day. And we hope that we all will continue to make the right lifestyle choices to enable healthy aging. Thank you so very much, and it's back to you, Dan.
Thank you, Mrs. Park. All right, so it's 12 o'clock, but I want to crave your indulgence for 5 minutes, everybody. Our executive director is here. We love her so much. I don't know if she's going to allow us to see her face. Oh, excellent. So I want to allow her to talk to us. She'll greet us, and then we'll MFR. The floor is yours, ma'am.
Well, thank you very much. I'm not going to say too much because everybody's been here waiting, but just to say thank you for a really, really great and educational event. Dr. Kugwa is not around, but thank you to her. She's always been so supportive and on point. And Dr. Ogato is a member of the Elder Policy Committee. You've been so helpful, so resourceful, and a lot of your words of wisdom today are very much, taking on. And I like what you said, that we should not assume that just because we have a document, the policy means the policy is okay or that it will actually get done. I think it's important for us to just keep at it on an ongoing basis. One thing I'd like to add to what you said is that in the development of policy, I think it should not just be that we involve the older persons, which we did in the policy, but something I learned recently is that ageism it's beyond just the older people. It's also about us not recognizing the younger ones. And I think in a policy that will eventually affect everyone, we should also involve younger people to see what they think and get their perspective. And I think that's something we have not done, and it's something we really need to do. So, but thank you so much. Policy is definitely a great starting point. No, research is a great starting point, as you rightly said, which drives policy, and policy drives action. So thanks a lot, and I appreciate you all. Thank you.
Thank you, Mrs. Ifueko. That was spot on. Thank you for including the young ones like us in the picture.
You're not young, oh, you're not young. You're not the people I'm talking about. You're old.
Okay. All right. Just to mention, I saw Barrister Eze Ohime of the International Organization on Migration, IOM. He was earlier on with us. Thank you for joining. Mrs. Uwa Ohime, thank you for joining. I saw Osayuki Ohime. Thank you also for joining. And they are no longer, some of them are no longer, but I thank you for taking out time to have joined us. All right. I want to also thank the team of Dagomo, all Dagomo members who are here. Thank you. You are the guys you are the real deal. Thank you, Joseph. Thank you, Stephanie. Thank you, Mr. Emmanuel. Thank you, Patience. Thank you, Luke. This is your victory. You have done this, and I want to appreciate you in the presence of everybody, the whole world. All right. Thank you, Titi, once again, Titi Parker, our CPO. Thank you for doing this. Thank you, Dr. Ogato, once again. Thank you, Dr. Ogugwa, for putting this together and making this a day. Dagomo, you can know more about Dagomo by logging onto our website, www.dagomo.com. We are on Facebook, Instagram, we are on Twitter. I would like you to please take out time to know more about Dagomo. If you want to volunteer for us, feel free to look at our website and volunteer in any capacity you feel you can. We are all embracing, all ages embracing. In Dagomo, it's all about making life worth living for humanity. So on the way again in November, we'd like you to stay safe and, just keep being a bridge to make everyone in society happy. I'd like you to smile as we close. Thank you.